Hello and welcome to ERPM Notelog. Today I will be teaching you about supracondylar fracture of humerus. It is a fracture of the distal humerus in which the fracture line lies just above the radial and coronoid fossa transversely. The epicondyles are not involved. The jagged line in the following diagram shows the supracondylar area. Clinical features. It occurs in children of 5 to 8 years with history of fall on outstretched hand with hyperextension of elbow. They present with pain, swelling and deformity at the elbow. Examination. Palpate the radial pulse. If the hand is pale and pulseless, it's a surgical emergency and reduction should be done urgently due to Volkmann's ischemia. Check for neurological injury. The anterior interosseous, radial and ulnar nerves can get injured. Check for compartment syndrome. I have done an entire video on compartment syndrome. You can find the link on the top right hand corner of the screen. Investigations. X-ray of the elbow joint is done in AP and lateral view. The most common displacements are posterior shift and posterior tilt. Gartland Classification. There are 3 types in Gartland Classification. Type 1 is an undisplaced fracture. Type 2 is a partially displaced fracture with an intact posterior hinge. Type 3 is a completely displaced fracture. Treatment. If it's a Gartland type 1 fracture, an above elbow slab is applied. If it's a Gartland type 2 fracture, an above elbow slab with 100 to 110 degrees flexion is applied. The increased flexion closes the anterior opening of the fracture. Gartland type 3. If it's Gartland type 3, close reduction under general anesthesia is done and an above elbow cast is applied. If the brachial artery is injured, vascular exploration and repair of damage is done. Afterwards, open reduction and internal fixation is done. If the limb has compartment syndrome, conduct fasciotomy of the forearm. Then open reduction and internal fixation is done. And finally, rehabilitate the patient. The following diagram shows an above elbow slab. This diagram illustrates K-wire fixation. K-wires are used for internal fixation of the bone. Complications. Brachial artery injury can result in compartment syndrome of forearm, Volkmann's ischemia leading to Volkmann's ischemic contracture. Nerve injury can occur to the anterior interosseous nerve, which is part of the median nerve, radial nerve and ulnar nerve. Malunion results in cubitus varus, which is known as gunstock deformity. Following diagram illustrates gunstock deformity. Malunion can also result in cubitus valgus deformity, which leads to tardy ulnar nerve palsy. Thank you for watching our video. If you like the content, Please like, comment, and subscribe.